Topic for discussion today is something related to the dialysis adequacy. You can say a formula which is important in calculating how good the dialysis is. So that is urea reduction ratio. We'll see what is this urea reduction ratio. This parameter, urea reduction ratio, is helpful to assess the adequacy of dialysis, how good the clearance is. There are various uremic toxin molecules, out of which small molecule, middle molecular weight uremic toxins are there. Urea acts as a surrogate marker of these toxins. So if the clearance or reduction of the urea is good, that means the clearance is good. So that is the basic concept behind that. Urea acts as a surrogate marker of uremic toxin. How much urea is being reduced because of dialysis is called as urea reduction ratio. In short form, it being represented as URR. In dialysis textbooks or in the review articles, you might see a value called URR. What is the percentage? Let us see what is the formula to calculate that. The formula is very simple. URR, or the urea reduction ratio, is equal to pre-dialysis urea. That is, before the dialysis, what is the urea? Only urea should be taken? No, you can use blood urea nitrogen also. In some countries, since blood urea nitrogen is the primary report they will get in the KFT, they can use BUN. In countries where urea is the primary report that they get in the kidney function test, pre-dialysis urea you can use. After the dialysis, immediately after the dialysis, you can send another KFT and look for the urea value and divide it by the pre-dialysis value, and this can be represented in percentage. If it comes in fraction, represent it as a percentage. So this is the formula to calculate URR, that is urea reduction ratio. Before the dialysis, what is the urea in milligram per deciliter, minus after the dialysis what is the urea, and divide it by the pre-dialysis value, that same value that was there before the dialysis. So if I have to simplify this formula, it's nothing but how much reduction have been occurred. That is what this formula is. How much percentage of the total urea being reduced. That is what basically it is. So this is the formula for calculating URR. Okay, let me give you an example. Let us take this report. This is a report of a patient where you can see the urea is 375. This patient is a case of CKD, was not on dialysis. All other parameters are deranged. This patient we are going to take for dialysis. And we have given the dialysis, and let us assume after the dialysis the urea value became 200 milligram per deciliter. So before the dialysis, as is shown in the report, the value was 375 milligram per deciliter. After the dialysis, the value is 200 milligram per deciliter. So let us calculate what is URR for this in this case. So URR equal to pre-dialysis value, that is 375, minus the post-dialysis value, which is 200, divided by the pre-dialysis value, which is 375. So what is the calculation that is coming? This is coming as 0.46, or I can put it as percentage as 46%. If someone wants to know how it came, you put 175 divided by 375, it will come as 0.46 in the fraction. If you wanted to put it as percentage into 100, you will get 46%. So the URR is 46 percentage for this dialysis. The urea reduction ratio, the clearance you can say the achieved is 46 percentage with respect to the urea. So what is the URR ideal value? URR ideal value, nowadays we are not using that to give you one info because we are using some other advanced formulas to calculate the clearance. Previously when they used, or even in some scenario if we have to use, 65 percentage to 75 percentage might be the adequate clearance for a CKD patient. In other situation like acute kidney injury where dialysis disequilibrium syndrome risk is high, this value have to be adjusted or have to be expected to be lesser. But for MCQ purpose and also in CKD, what is the ideal URR target? Would be 65 to 75 percentage. As I told you, nowadays we are not using this URR. So what are the disadvantage of this formula in calculating the adequacy or clearance? Let us discuss that. If we say the disadvantage, it might not represent the exact clearance because many problems comes during the calculation. At what point of post dialysis period the sample was sent? Even though theoretically they say immediately after the dialysis, many times the sample might be sent at a various point of time, that is 1 hour after dialysis, 2 hour after dialysis. Since urea being generated in the body, that value might spike up and it might not tell the accurate results. First point. Second one, the urea being distributed in various compartments, intracellular, extracellular compartment, the distribution might not be equal and the generation of the urea might not be taken into consideration in CKD or in AKA because the generation of urea almost subjected to many other uh, variable parameters like intake of the nitrogen, patient nutrition status, those things are involved. That's why difficult to interpret. And this won't take into the consideration the time duration of the dialysis, how much time we have given the dialysis because of which this much clearance have been achieved. That it won't to taken into consideration. And since this URR once achieved a particular value, for example 70 percentage, does it indicate totally the patient achieved a clearance? No, it might not, because you have to take other parameters like patient body weight, patient build, patient muscle mass, the time duration of dialysis, the body compartments, the time which with which the urea being generated in the body. These much parameters are affecting this value, and since it is not taking into consideration any of this is having disadvantage with respect to calculating the clearance or adequacy. For adequacy, that is why we are using some other newer formula KT by V that we will discuss in some other video. Probably that KT by V is a bit concept oriented formula where it might be required only for a DM nephrology student. For MD medicine residents, probably that might not be required. Probably this is the simple ratio that you can just check to see whether at least that particular session of dialysis is giving a clearance or not. Especially in AKA where urea generation might be faster. If a sample is sent 5 or 6 hours after the dialysis, if the urea create value, for example, pre-dialysis urea is 300, if it is sent after 8 to 9 hours, if the urea is around 250, there might be doubt whether this dialysis was effective or not. So during that time, yes, this URR sending the urea immediately after dialysis and checking the value might help how much percentage we have achieved during dialysis. So this is all about URR. I hope the concept, at least for the residents or the dialysis technologies who want to know what is this URR, I hope it is clear. We'll see in another video. Bye bye.